Hello and welcome to Sedaye Daneshjoo. My name is Damaris.
And my name is Ryan.
And my name is Ayeneh.
My name is Caitlin.
And on today's episode, we have a very special guest, Caitlin, who is currently a first-year PH student at West Coast University.
Thank you for having me.
Thank you for being here. We're so excited to have you today.
Me too.
So I just want to start in asking you, when and how did you know you wanted to be a PA? That's kind of a big choice, right? Deciding on what career for any young person. So how did you come to the conclusion that you wanted to be a PA?
Yeah, so I wasn't always PA. I feel like anyone who starts off pre-health, their first go-to is like they want to be a doctor. And along that journey for me, I realized that a PA was more fitting for me, lifestyle-wise, and just the profession, what it entails. Yeah, so personal experience, a family member of mine, they had a vascular event, and when I was visiting them at the hospital, a lot of my interactions was with the main PA, not so much the doctors and the neurologists. I did have some communication with them, but most of them, it was through the liaison of the PA. And I really liked that patient interaction that they gave. And that's what kind of influenced me to learn more about what it means to be a PA. And just from learning more about it, the big emphasis on patient interaction and patient care, I really like that aspect. And some people, they ask me, oh, if you like patient care, like why not nursing or nursing practitioner? Kind of entails the same thing. And while that is true, I would say that PA, there is more emphasis on medical knowledge learning. Nurse and nurse practitioner, it's more on bedside care and bedside learning. Personally, I like learning about the pathophysiology of everything, of the the molecular level and leading to like how it translates into a symptomatic level. And that just, it resonated with what I wanted to learn about going into the pre-health space. And also I can also like still prescribe, treat, diagnose. I like that aspect as well, treating the patient. And yeah, it just really fit with what I wanted to do with life.
Caitlin, I have a question for you.
Yes.
You articulate your answer really well, and it seems like you've done your due diligence of distinguishing between the career physician and PA. Was it also the advertised flexibility in being a PA, schedule-wise and specialty-wise, the variability in what you can practice because you're not so hyper-specialized? And then also, where do you weigh in on the cost to your education? This is a real cost. So if you, for example, compare like curricula in like Rush Medical School, they publish their curricula base for their PA program and their doctoral program, and they're nearly identical. And so when people say that, you know, PA is less educated, they're less educated. You need to educate yourself on that PAs are actually pretty much identically educated didactically as a physician. Where they diverge is in some of those classes, like you're saying, of the why. The histochemistry is often omitted from PA programs. Did you do, as a part of that due diligence, shopping around for a PA program that went above and beyond in educational standards, or is PA education mostly standardized across the country?
So to answer your first question about that flexibility,
Lots of questions.
no worries. I love that. Yeah, that was another big reason why I chose PA, because of that flexibility, or what we call lateral mobility. We don't have to just stick to this one specialty after this amount of education and learning about it. I like that aspect because for me, I like to learn. I like to think of myself as like a lifelong learner. If I learn one specialty, I for sure will become bored of it, or I want to learn more outside of that. So I know that medicine, it interconnects. Lots of times it interconnects. And I really like that ability just to have a different focus or shift the focus in specialty. So yes, I really like that. I really admired that aspect of the physician assistant or associate program, or occupation, sorry.
What do you call it? Do you call it physician assistant or physician assistant? I know that that's an
Oh,
item
that's
of
another
business.
like controversial
Yeah.
take. So, for the longest time, it was physician assistant. But from the eyes or the ears of a patient, when you hear assistant,
Yeah.
it sounds
It's demeaning.
like, exactly, it doesn't give it the full context of what it actually is. So, a lot of states, I think we're at 3 out of states in the country to change it to associate, just so it gives it more meaning and emphasis on what it really means or what the occupation entails. But yeah, so like I said, the lateral mobility, I really like that aspect. As for choosing my specific program, I would say most of the PA programs, they are standardized in just general knowledge and like the pathophysiology of everything. Yes, you are correct that doctors or physicians, they do have a more in-depth learning and emphasis on specialties and and certain conditions. I think that's what we don't get too much coverage of, are the zebras. The zebras, like, not things that you don't really see clinically like every day. The things that happen maybe once in 100,000 patients. We don't get that exposure as much because we're more entailed to the general population and what they might come in for symptomatically.
And I guess just as a final add-on, I'm sorry for taking away from your questions that you designed yourself. Where do you stand on the ideology and the history of PA? So you get behind the objective of the PA from a historical sense, and maybe because I'm not totally knowledgeable about that either, could you share that with us if you know?
Oh, I'm so glad you asked. Okay, well, I'm not the best to really ask about this, but I do know the PA profession, it started based on the I think it was World War II. Don't quote me on that, but it was
pre or post when they added that residency, physician residency cap. You know what I'm talking about?
Yes. I think there was there was a need for physicians and for PAs.
Like, to the best of my knowledge, there was a point where, because there was actually a surplus of doctors, and that has multiple implications for healthcare systems, for the cost of patient services on a private and on a public end. So we're in this capitalist system, we're looking to kind of bring those margins a little tighter. And so they capped residency spots. And that's why now us pursuing the doctoral degree and being a clinician are looking at capped residency spots. Not enough spots for the applicants would be. And I think to sort of subsidize that need for clinical care and the absence of physicians as it started to teeter down around the 80s, because that was like 70s, 60s, mid 60s era, around the 80s is when the PA education became standardized. And then more and more PAs started getting churned out for the objective of exactly that. We have, do we really need all these classes on histochemistry and all that crap?
Yeah.
We can get people that are basically just as knowledgeable, and we can get them all over the place. And it's easier on us. And it also comes at the cost and benefit of the applicant, like yourself, that you have that flexibility and you have almost a trade, a pro and a con and autonomy. It depends. It's a case-by-case basis. I'd be curious how you weigh in on that also. But does that kind of line up with the timeline? And the reasons why?
Okay, yeah, now that you mentioned that, from what I remember, it was post-war and there were a lot of medic veterans. Their only experience on the war field or front lines was taking care of their fellow soldiermen. And when they acclimated back into reality, there wasn't a lot of outlets for them to explore. And the first PA university, Duke University, I forgot the physician who led it, but they saw that there was a need for physicians. And yeah, you're right. There was like a surplus going on.
Yeah, there was like a reverberation, a dip below the norm.
Yeah.
There was a surplus, and then we kind of dipped below, and then
Exactly.
there was a need.
Yes, exactly. So to accommodate that dip and that need for physicians, and also to solve the problem of all these medic vets being unable to really have a outlet for occupation, I believe he took 6 medic vets, and
Oh, wow.
they
The
composed.
first PA class. Of
Yeah, they
6.
composed of the first PA class, and since then, that's how the profession began, and it has just been growing exponentially since then
Yeah,
because.
But no less competitive.
Yeah, exactly. Yeah,
Yeah.
yeah. But yeah, I think that's it. It's a great occupation because there is a need for physicians, and some people they might not have the expenditures to pursue that field of medicine.
What do you mean by that?
Well, cost-wise, time-wise, I know it's a big time commitment. With the 4 years in residency, you don't know. Some people, they have personal things going on. It's hard to fit into their lifetime, especially if they do know that they want to go into medicine. And I think PA and other professional healthcare occupations is a great alternative if they do want to commit that time to go into a healthcare professional position.
Well, I have more questions, but I'm going to defer it to the Mani.
Okay,
Let you get
okay.
through some of those. I'm sure I kind of stepped on your toes. I'm sure there's more on there that overlapped.
I'm actually wondering about something that's not even on here. So you were kind of describing the PA as a profession and kind of what is really good about being a PA with the lateral mobility. I'm curious to know what possibly hardships or problems could you foresee with being a PA?
Oh yeah, yeah. There is also some controversy on that. So, as I don't want to implicate the name, but physician assistant, physician associate, you are under a supervising physician. So there are some limitations to what you can and can't do. Like I said, we can prescribe, treat, and diagnose. We could do some surgeries, but we can't do independent surgeries. That is with the general surgeon or whoever.
You're always acting as a first assist.
Yeah, I would say about, yeah. We're not always, we say that we're under a supervising physician, but if we're interacting with a patient then when we're with a patient, we're one-on-one. It's a direct.
More independent than it
Exactly.
necessarily entails on paper.
Yeah, exactly. Yeah, but yeah, the job is technically under a physician or supervising physician. So.
Okay.
What so the heart of this question, I think, is also important to touch on. Do you foresee any complications, like in the politico sphere or the healthcare system sphere of PA, that like PAs have been warning you and you students about this, and this is what you're facing? Like, for example, doctors were warned about, oh man, insurance is just so annoying, the work hours are so annoying, it's such a pain. Those are things that we're kind of primed on as pre-meds or med students. Is there anything similar for PAs?
Like a heeding warning about it, or
Yeah, heed this. There's nothing, it's all hunky-dory. It's like, you're actually gonna be pretty good, you know?
I feel like there is, but nothing that really comes to mind, at least personally. Like I said, this occupation, it's what fits with my life and what I wanted as an occupation.
So you have like the best possible outlook.
I would say that if, for someone who does want to pursue PA and they want that autonomy, then yes, they might have a problem with being under a supervising physician. They might want more, I guess, ability to make decisions. For me personally, I like to collaborate. I like teamwork. So personally for me, I don't see that being a problem in the future. But I could definitely see it being a problem for someone who does want that autonomy for themselves.
Thank you.
Now, I'm going to ask you, kind of pulling back a little bit, because right now you are a first year, right?
Mhm.
First year PA student. So, when you were applying, you went straight from undergraduate to PA school with no gap. Why? Why?
Why did you do that to yourself?
Because it seems very difficult, especially the PA application itself. It's a lot of clinical hours, a lot of volunteering. I saw that you did have lots
Your
of
LinkedIn is
volunteering
loaded.
over many years. And so how was it really focusing on building a really good application while in undergraduate?
Yeah, why did I not take a gap year? I ask myself that sometimes. And sometimes I'm very grateful that I didn't. So yeah, for the hour collection, oh well, let me start off with what is required to apply to PA programs. Most programs, a minimum of 1,000 clinical hours, so direct patient interaction is
What's
needed.
the average?
Average competitively 2,000. I applied for 2,000.
We saw, we were doing some research before the show. We saw 3,000, 4,500 was like
Yeah.
average matriculant. It's
I could
high.
believe that.
And I also am inclined to say that PA school, and this is the census online, and with people we discuss this with, PA school is more competitive than medical school and admissions. And it's for different reasons. And maybe you could continue sharing about that.
Yeah, I think that's kind of what I mentioned earlier. A lot of people, maybe med school isn't fit for their lifetime, but PA being 2 to 3 years and kind of more expendable like that, it just seems like the better option for them. And I think that's why there's a lot more competitiveness in that application sense.
Compared to a medical applicant, I think the average item, maybe you could weigh in on this, the average matriculant will have somewhere of maybe 300, 500 clinical hours. Yes, you know, there's the exceptions of people that don't have a huge amount of clinical hours. What even goes into clinical hours? Does that include shadowing, volunteering, etc.? Where I'm talking about like patient interaction hours, whether they are your patient or not. So the thing that you would put in your AMCAS or a COMAS of, or the Texas application of like volunteering clinical, paid clinical, that's the type of stuff I'm talking about. Somewhere 300, 500,
Yeah.
not 2,000, right? I think
Yeah.
UC Davis, so that's our in-state public, one of our in-state public medical schools. They are, to my knowledge, the highest matriculant clinical hours, and it's like 2,000. I'm like, whoa, like that's more like a PA school. So they're,
Yeah.
and it goes with their mission statement, their objective. We're trying to train people who are more personable and more hands-on. Would you say that that is what factors in, and it has to do with the objective of PA schools?
Well, I'm glad you said that because now that I'm thinking about it, because PA school is only 2 or 3 years, they do want you to have that prior experience and that prior knowledge so they can really hone in on that and guide you with what you know coming in. Because yeah, for medical school, you don't need all these hours, but medical school is a lot more long and rigorous, and they have more time to really to really mold that provider mindset into you and
Work on how not to be a robot.
Exactly, yeah. So compared to PA school, it's very short. You're learning a lot of information in such short amount of time. Didactic year is 1 to 1.5 years, and you're learning all the specialties and everything that you need to know for your entire profession in that
crazy.
length.
Yeah.
So the program, knowing that you have experience in X, Y, and Z, they have some promise in you that you're willing to learn. You're willing to build up from what you already know coming in. And yeah, I think that's why there's just such a heavy emphasis on having so many patient care hours, healthcare hours, volunteer experiences, to really mold that, to pre-mold that, I guess, not provider mindset yet, but just that personability,
Or a safe
character.
bet.
Exactly, yeah. Yeah.
So how was it getting all of those hours for yourself? How did you do that? And then also What was one of the most meaningful experiences that you would say that you've had so far in that work?
Um, well, for me, my hours were kind of all over the place. Um, I worked in a private derm clinic, so I learned a little bit about dermatology through that. I worked in an oncology infusion center, learned about chemo, some antibiotic infusions. And then I volunteered. I didn't learn too much from volunteering at a emergency department, but I learned the more of the teamwork, I guess, and how the communication, how efficient it needs to be in order to complete a goal for a patient. Um, and then I had some other like here and there. I know I focused a little bit on geriatrics when I was on a medical mission in Peru. Um, yeah, with the mindset that I was applying to PA school, I wanted to learn as much as I can from different specialties because, again, like I said, with the short amount of time of learning everything else, I wanted a good foundation to build upon from that. Um, as for meaningful experiences, um, honestly, most of my meaningful experiences were from my volunteering opportunities. I volunteered for a bit with LA Mission. It's a it's a food shelter. Not so much a food shelter. They have a food shelter area, but they also help with helping the homeless population um, with jobs and security and housing and everything like that. I learned a different face of my community that I have not met before, and that was the tragically underserved portion of it. I'm from LA County, but barely am I familiar with that space. So, from volunteering there, I was able to personally get to know these individuals, their hardships, and really try to connect with them from a sphere where I basically had no relatability to them, but I was able to empathize with them, with their situation, and I think that was the one of the meaningful experiences that really helped me now, I guess, with like practicing OSCEs and patient interactions, things like that.
Wow. And all of this while with no gap year as well. That's like super impressive. So I'm like wondering, is there any advice you would give to like any pre-PA students who's like trying to juggle like classes with these activities as well?
Um, just know your limits, know your bad habits. For me, I had to learn my bad habits before I was able to focus because if you don't address your bad habits, you're going to run into them constantly, consistently. For me, my bad habit was time management. I would always say yes to multiple things, but my time management would just make me stumble and just not be efficient as I wanted to. So addressing that, I was able to be more decisive on when and how I could fit in those yes opportunities. Yeah, so managing your bad habits, and then as independent I try to be, I need to remember that it is okay to be interdependent or dependent at times because it is a self journey, but it's not just you on that journey. There's a lot of people in the background that have helped me to be where I am right now, and I'm very grateful. My family, my friends, my mentors, especially my mentors, they were able to really uplift me when I needed that uplifting or when I had any doubt. They were able to support me when I was confused of what to do, where to go. They were able to give me that guidance and that sense of just support. And I think that's what's really important. So, yeah, bad habits and don't be afraid to be dependent at times.
Thank you, Caitlin.
Yeah.
Thank you so much, Caitlin. Unfortunately, we are out of time for today. We really appreciate your insight and your being able to be here and answer all of these questions.
Yeah, I'm really glad to be here
Yeah,
and
thanks,
see everyone.
Thank you so much for coming on.
Well, I'll outro us. Thank you everyone for watching, and we will see you next time.